Sawadee Kap. Welcome to Break Time with Monte. Today's story, flu is here, but don't panic. Reports of flu cases spreading to health staff at Sirirat Hospital is not a reason to panic. Dr. Prasit Watanapa, the Dean of the Faculty of Medicine, says, thus far, the flu situation in Thailand has been rather mild, the DDD says. The public ministry has urged people to remain calm after warnings about seasonal flu spread on social media. Netizens said a virulent strain of influenza was being passed from patients to healthcare staff at Sirirat Hospital. Dr. Prasad Watanapa, Dean of Sirirat's Faculty of Medicine, told the media Monday 5 patients had been admitted to the hospital with the H3N2 influenza virus. 1 died of bacterial infection, but 2 have been discharged, and the remaining 2 are not in serious condition. 4 of 19 health staff who had contact with the patients contracted the flu. He said none are seriously ill. On social media, it was claimed the patients were suffering from an influenza A strain of the H3N2 virus known as A Switzerland 9715293. However, Dr. Prasit said the strain of the virus affecting the 4 patients had not yet been identified. The strain does not represent a serious risk of an epidemic and is not drug resistant. Influenza is a contagious respiratory illness and is classified into 3 types. Influenza A, H1N1, H1N2, H3N2, B, and C. From January 1 to February 23, the Department of Disease Control reported 10,032 confirmed cases of the flu, with 8 people dead. Most of the people who died had chronic illnesses and missed flu vaccinations last year. DDC Deputy Director General Opart Karnwinpong said 24 deaths were reported in the same period last year. In 2014, there were 74,065 cases of influenza with 86 deaths. About 68% of patients contracted H3N2, of which 90% had the A Switzerland strain, 24% had influenza B, and 4% contracted H1N1. There's no need to panic right now, Mr. Opart said. The DDC is preparing to give 3.5 million flu shots to at-risk groups such as children, elderly, pregnant women, and patients with chronic diseases at the end of next month. And now, today's vocabulary. Admitted, admitted, bacterial, bacterial, calm, calm, chronic, chronic, claim, claim, classify, classify, condition, condition, contagious, contagious, contract, contract, dean, dean, deputy, deputy, director general, director general, discharge, discharge, elderly, elderly, epidemic, epidemic, faculty, faculty, identified, identified, infection, infection, influenza, influenza, media, media, netizen, netizen, panic, panic, particularly, particularly, patient, patient, pediatrician, pediatrician, period, period, pregnant, pregnant, prevention, prevention, represent, represent, resistant, resistant, respiratory, respiratory, risk, risk, seasonal, seasonal, situation, situation, social media, social media, spread, spread, staff, staff, strain, strain, suffer, suffer, urge, urge, vaccination, vaccination, virulent, virulent, warning, warning. That's today's story and vocabulary. You have a great day. I'll see you next time here on Break Time with Monte.